cannabinoids and their therapeutic applications in mental disorders. I'm going to read this word for word so you can decide for yourself what impact this article has on your opinion of medicinal marijuana. Abstract. Mental disorders represent a significant public health burden worldwide due to their high prevalence, chronically disabling nature, and substantial impact on quality of life. Despite growing knowledge of the pathological mechanisms that underlie the development of these disorders, a high percentage of patients do not respond to first-line clinical treatments. Thus, there is a strong need for alternative therapeutic approaches. During the past half-century, after the identification of the endocannabinoid system and its role in multiple physiological processes, both natural and synthetic cannabinoids have attracted considerable interest as putative medications in pathological conditions such as, but not exclusive to, mental disorders. Here, we provide a summary of cannabinoid effects in support of possible therapeutic applications for major depression, bipolar disorder, anxiety, post-traumatic stress disorder, and schizophrenia. Considering this evidence, highlighted benefits and risks of cannabinoid use and management of these illnesses require further experimental study. And it goes into an introduction, has specific paragraphs for major depressive disorder, bipolar disorder, anxiety disorders, and post-traumatic stress disorder, as well as schizophrenia. But we will skip ahead to the conclusions and future directions. Despite the constant rise of global prevalence rates, many of the current therapeutic options for mental illnesses are far from being ideal in terms of both efficacy and adverse effects. In this scenario, there is an increasing demand worldwide for using cannabinoids as a treatment for various mental disorders. Their therapeutic potential is suggested by the fact that the endocannabinoid system on which they act is malfunctioning when evaluated in psychiatric patients. This system plays a fundamental role in a large variety of physiological processes, including neurodevelopment, cognition, emotional states, and stress responses. It is therefore not surprising that its dysregulation may contribute to provoke some of the clinical traits present in patients with mental disorders. Thus, targeting the endocannabinoid system may represent an alternative or additional effective approach for their treatment. Although most of the studies reviewed in this article highlight an improvement in psychiatric symptoms, the evidence encouraging the use of cannabinoids in mental disorders is still unconvincing. The few clinical studies done so far have limitations, both in the number of patients and in the duration of therapy. Moreover, reliable follow-up information is missing. Furthermore, several investigations evaluating the benefits of cannabinoids on psychiatric symptoms in patients with other medical conditions, e.g., chronic pain or multiple sclerosis, have produced mixed results. On the other hand, larger longitudinal studies highlighted harmful consequences associated with regular and heavy cannabis use in psychiatric patients. In light of these facts, high-quality clinical trials will be necessary to confirm the efficacy and safety of cannabinoids, specifically in patients diagnosed with a specific psychiatric condition, according to the Diagnostic and Statistical Manual of Mental Disorders. It would be useful for these clinical studies to be integrated with measuring both circulating and cerebrospinal endocannabinoid levels and/or by examining differences in endocannabinoid signaling between individuals with psychiatric illness and healthy controls before and after the treatment with cannabinoids. Thank you very much for listening to this very convincing and unconvincing article, which basically says that there is some initial benefits, but it's also contrasted by studies that show heavy long-term use has some very negative implications for your mental health. And really what we need is just more and more studies on this very subject. And I think the middle ground is somewhere in between. Looks like the endocannabinoid system plays a big part in how we feel. And maybe marijuana is not the best way to get to balance it out. I'm sure in the future, marijuana will show that it is somewhat of a wonder drug. But at the same time, with anything, you can overindulge something that just feels really good and makes you feel really good. And little by little, your body creates a homeostasis. And for some reason, it doesn't want to feel that good all the time. It wants to get back to normal. So have any comments? Please leave them. Please like the video and let me know what else you might want to see. and I will continue trying to search for some illuminating articles on marijuana and their effects on your mental health. Thank you very much.